Well, $940 billion, that is how much the nonpartisan Congressional Budget Office says the House health care bill will cost over 10 years. The question, who is paying for it? Some Americans. Our taxes are going up for some people out there. The biggest revenue raiser to pay for health care reform is going to be higher Medicare taxes on people making more than $200,000 a year or couples making more than $250,000 a year. Let's give you an example. For someone that is making $250,000 all in a year. Currently, they pay just over $3,600 a year in Medicare payroll taxes. Under this bill, that would go up $450 to just over $4,000. Now, high-income households would also pay a 3.8% Medicare tax on investment income like dividends or interest. But we should note here, for the majority of Americans that aren't considered high earners, their Medicare taxes are not going to change. Another big way that this is going to be paid for is a tax on the so-called Cadillac health care plans. It is still in this bill. It is watered down, though, a bit from the Senate version. This should raise $32 billion over 10 years, but we should note this does not kick in until 2018. So here's who this applies to: individuals that have a health care plan of $10,200 a year or more, or families that have a plan that's over or at $27,500 a year. The idea is you tax insurance companies more on these high-end plans that they offer. That will push them to offer cheaper plans instead. The thinking here, people often buy much more health coverage than they really need. The goal, bring down the overall cost. Of course, you can see all the details here on CNN Money. We're constantly updating the story, but I should note that starting in 2015, people who don't get health care coverage in this country, they're going to be fined just about $325. That's going to apply to almost everyone in this country. Again, more details on the site.